Hello, everyone. Welcome to the Edelweiss channel. And right now, this is Dr. Jean, one of the consultants of Edelweiss. And I have a very special guest, a dentist who is practicing in Indonesia. And we will be discussing to you how you're going to have a root canal therapy and afterwards have a single appointment, which doesn't involve you having a crown. And it can be done in one day. Okay, and yes, in one visit. And I will introduce to you our very special guest. So let me introduce to you, and I'm very honored to have him here with us, Dr. Rio. Yay! Dr. Rio, please tell our audience who you are and what kind of dentistry you practice.
Okay. So, hi everyone. My name is Dr. Rio Suwandi, a general practitioner who practice in the Tangerang and in Jakarta. So, I usually do a root canal treatment and do some restoration after the root canal treatment and do some implants and aesthetic feelings. Yeah.
So you do a lot of things.
Yeah, a lot of things.
Yes. Dr. Rio, kindly tell them what is root canal.
Okay, first thing first, what is the root canal treatment? Maybe for the patient who have a toothache, she's a very like and very painful.
Palpating.
Yeah. And then because the caries is already moved to the pulp chamber, and
that's the nerve.
Yeah, it's make it very hard and very hurt, and it makes a patient is afraid to go to the dentist. It will be very painful when he go to the dentist. Oh, the painful is. Maybe it even be more painful if I go to the dentist. Let's make the patient is afraid to go to the dentist. Yes. But when you go to the dentist solving your problem. Yes. How to solve the problem? We do the root canal treatment.
Yes.
We're taking out of the infected pulp.
Yeah.
And after that, we clean it. We cleansing, we sterilize the root canal treatment. After that, we put it back with the gutta percha. After that, we restore the crown for the tooth, and the functional is come back.
Okay.
Yeah, okay.
So, a lot of you are afraid of root canal. When they hear RCT, they think it is painful. But we are happy to tell you that we are in the technological age, and there are a lot of ways and means for dentists to do RCT or root canal therapy that is definitely not painful and can be done quickly, right, Dr. Rio?
Absolutely right. Because before you come to my clinic, after you come to my clinic with my appointment, I will do the anesthetic first.
Yeah.
Feel you numb it first.
Okay.
The pain is gone first.
Okay.
After that, we do the root canal treatment. Usually, my patient come to my clinic, and I do just only one visit and a done.
Okay. So first, you need to do radiographic examination, right?
Absolutely.
This is the step by step, and the radiographic examination, we call it periapical X-ray. Yes, and this has a separate cost, of course.
Yeah, absolutely.
And then during the treatment, sometimes the dentist, right, Dr. Rio, they will take 1 or 2 periapical X-rays to be guided on their treatment, right?
Yeah,
right?
Absolutely right.
Yes. And then, just like Dr. Rio said, he will apply anesthetic solution.
Anesthetic solution first to make
For
it numb. Yes.
And then after that, then he will now extirpate or remove the pulp, correct?
Yeah, absolutely. Remove the pulp.
Yes.
We enlarge the canal
Yes.
to clean it all, the bacteria and everything.
Yes.
We clean it with the solution.
Yes.
With the NaOCl solution, we clean it, we sterilize. After that, we obturate it with the gutta percha.
Yes. So after that, normally, Dr. Rio, the final restoration, of course, in order for you to access the canal or the where the pulp is located, sometimes the natural crown of the tooth is gone,
Yeah.
right? And majority, the final restoration is crown,
Yes.
which is quite expensive.
Yeah.
But we are happy to tell you that there is an option, especially if the crown, the natural crown is still there.
Yeah.
Can you tell me something about this treatment?
Okay. Usually, when the crown, the crown is left is already half. Usually, I use the ceramic and for the endo crown.
Yeah.
Yeah, for the CAD cam restoration.
Yes.
But when the crown is still good and we don't want to make the crown is cracking, better
Yes.
we change the tabletop.
Yeah.
So I have another solution in one visit too.
And now we will show you one of your cases,
Yeah.
Dr. Rio, right? So in this case, you did the root canal, correct?
Correct.
And then, as we told you the procedure,
Mhm.
what was the final treatment that you did for the patient that is one visit after the root canal?
Okay. So first thing first, this is the
So
clinical.
what is the treatment called onlay, right?
This is called, we said onlay, veneer onlay.
Okay. Okay, so what is basically an onlay, Dr. Rio?
Okay, onlay is a restoration. Usually the restoration after the root canal treatment.
Okay.
Yeah.
So besides the crown, they can do onlay.
Yeah.
But basically, onlay is just on the top
Yeah,
of
you change the tabletop.
the tabletop of the crown.
Yeah.
Okay, so not the entire crown, natural
Yes.
crown. So you conserve majority
Yes.
of the tooth structure,
Yep.
correct? Okay, so you will now do the onlay preparation.
Onlay
correct?
preparation. So
Okay.
in this case, this is like interesting case. The patient come to me. I do the root canal treatment. After that, he want to change. But so this patient come to my clinic. He already do root canal treatment, but because the crown is a little bit expensive,
Yeah.
so I offer him one of the solution. That's called the OVD from the Edelweiss dentistry, because it changes the tabletop. Preparation for the onlay. So I reduce the occlusal for the top from the crown at least minimal half.
Uh-huh.
After that, I put with the composite and with the top tabletop from the OVD, and the result is very very perfect.
Okay, so just to show you how this is done is basically you do the tooth preparation first. That's number one.
Tooth preparation first.
And then the second one is now you apply the
I see.
onlay, which is the occlusion VD,
Okay.
right?
Yeah.
So you prepare the occlusion VD first,
Yes.
which you try to create mechanical
Okay.
retention, right?
Okay, so now after I reduce the occlusal from the tooth, after that I prepare the OVD.
Yes.
I make it reverse in the inside of the OVD. After that, I do the etching for the cleaning for the debris.
Yeah.
After that, I put the veneer bone.
Yeah, the
After-
veneer bond is applied very thinly, right?
Very very thinly.
Yes.
We after we apply with the microbrush,
Yes.
we spray with the air.
Yeah.
After it's very very thin, we lightly cure.
Yes.
After we light cure it, we put the composite.
You roll, you get a composite and then you roll
Composite.
it.
Yeah,
You
you
roll
roll
it.
it first and put it in the
The
OVD.
back, yeah.
The back in the OVD. After that, you put it inside the pulp chamber.
Yeah.
After you
But
put
this one, you don't etch band first the tooth, right? Because you need to copy your tooth prep first.
Yes,
And then
absolutely.
you ask the patient to bite it.
yes,
Yeah.
to make it the bite is nicely
Will
will
fit
fit.
on
Yeah.
And then you remove again the OVD.
Yes.
And
And then
then
we
what
clean-
do you do on the tooth?
We're trimming the rest of the composite. After that, we like cure it and we cement it.
Yeah, so but in cementing the tooth, you need to etch the tooth.
Oh
right?
yeah, absolutely. We
Yes.
etching the tooth. We put the bonding for
Yeah,
the tooth.
banding, right?
Tooth bonding. Every treatment for the tooth and
Yeah.
different every every treatment for the occlusion of VD.
Yeah.
After that, we put it together, we cement it with the edelweiss composite.
Yes, and then you cure it.
Yes, absolutely.
And then this can be done in one sitting, right?
Perfect.
Yeah.
That's what I like it.
Yeah. And I think everyone will also like it because one, it conserve majority of your tooth structure.
Yep.
And then another thing that I think Dr. Rio they will like is that this is cheaper than the crown, right?
Absolutely, absolutely.
Yes, and then you save time. And also Indonesia is similar to Manila, where the traffic is really bad.
Yeah.
So it saves you time.
Save time.
For traveling time from your work or from your home going to the clinic.
That's why we do in one.
Yeah, one sitting.
One
so
sitting.
what is the exciting part here, Dr. Rio, is that you do the treatment, the root canal treatment for one sitting also, and then the final restoration in one sitting.
Mhm.
Wow, perfect. So, Dr. Rio, if you don't mind, if the people from Indonesia would like to visit you, we will place it in the description below where you can contact Dr. Rio here. And
Dankeschön.
yeah. And thank you so much
Thank
for
you.
watching our short presentation and to let you know how to do onlay after root canal therapy. And this can really be done in one sitting. Thank you so much, Dr. Rio,
Thank
for
you very
gracing our channel.
Yes.
And I hope you have learned a lot during the discussion.
Yes.
Bye-bye.
Bye bye.